That cruise ship, the Carnival Magic, back in Texas tonight, along with that hospital lab worker who sparked Ebola fears. She left that ship before dawn today after being quarantined in her room, tests already clearing her of the disease. This as disease detectives tonight still race to track down all those people who might have come into contact with Amber Vinson, the nurse infected with the deadly virus. The list now well over 100. And for some healthcare workers, the critical time is now. ABC's Tom Llamas is in Dallas with the story.
Today, the woman at the center of that Ebola scare on the cruise ship Carnival Magic disembarking. The ship and its 3,600 passengers back in Texas after Mexico and Belize refused to grant her access.
She shouldn't have been on board. She should have stayed home.
Cleaning crews now preparing to scrub every inch of the ship. On Saturday, this was the view from the deck. As passengers partied, a Coast Guard helicopter hovering above on a mission to collect a blood sample from the Dallas lab supervisor who handled blood samples from Ebola victim Thomas Eric Duncan. Even though she didn't have a fever and was showing no symptoms, she'd been quarantined in her cabin for days.
When it first came out, there was kind of panic.
Around the time the boat docked in Galveston, word she tested negative for the virus. She was allowed to go home. But tonight, a critical time for those 75 Dallas healthcare workers who treated Duncan.
We're right in the middle of the hot zone, right now. And so we're doing a whole lot of work.
It's been 11 days since Duncan died, exactly the time when symptoms are most likely to be present. Nina Pham, the first nurse to contract the disease, still in isolation tonight.
It's a serious disease and it kind of knocks you out. So it's mostly really being fatigued, but she's in very good spirits.
Meanwhile, authorities still tracing the contacts of that second nurse, Amber Vinson, who had traveled back home to Cleveland to prepare for her wedding. More than 100 people on that watch list so far. And tonight, new video of the bridal shop Vinson visited being decontaminated. At last check, her family saying Vinson in stable condition. And tonight, the 21-day monitoring window ends for the first 48 people who came into contact with Thomas Eric Duncan. In that group, his fiancée and his family. Cecilia?
And Tom, that quarantine order expires tonight at midnight. We heard today from Duncan's fiancée. What did she have to say?
Louise Troh released a statement saying that she's looking forward to her privacy, to spending time with her family. She also thanked Dallas County and city officials for their kindness and their generosity. This is going to be a very tough week for her because this is the week she planned on marrying Thomas Eric Duncan. Cecilia?
And our thoughts are with her tonight. Tom Llamas, thank you. ABC's chief medical editor, Dr. Richard Besser, is here with us now. So we saw that ship not being allowed to port, that passenger in quarantine. Is this justified? Is this panic? What's going on?
Yeah, when I saw these actions, I was baffled by this. This is a person who is very low risk. And when you take these kind of aggressive actions where it's not warranted, rather than reassuring people, it promotes fear. And right now we're seeing more of an epidemic of fear than we are of Ebola. Look at real risk. Duncan's family, his fiancée and her children, spent days with him in that apartment. They were with him before he went into the hospital. Tomorrow they come out of quarantine and not one of them got sick. That should put people at ease.
Now, what about those healthcare workers who cared for Duncan? This is that critical period for them.
Yeah, this is the very important critical window. A person with Ebola is most contagious right before death. Take a look at this graphic. For HIV, a small amount of blood has 1 million virus particles. For Ebola, it's 10 billion. So we're now 11 days out from the period he died. The healthcare workers who took care of him then, they're going to be checking their temperature. If by the end of the week no one is sick, we can all breathe a sigh of relief.